Welcome to your screencast on the bones of the thorax, where we will discuss the bony landmarks of the sternum, thoracic vertebrae, and the ribs.
So first we'll talk about the thoracic wall. This, of course, is protecting our heart and our lungs and organs that are in the superior aspect of the stomach. And we're going to start with the sternum, better known as the breastbone. So the word sternon in Greek actually means breast of man. But the sternum itself kind of looks like a sword. At the very top, we have the jugular notch. So if you take your hand, kind of go down the center of your neck until you hit a harder surface, that's going to be your jugular notch right there. The manubrium, manu means hand. So this is kind of like our handle of the sword. If you pass that jugular notch and continue on down, you are now touching the manubrium of the sternum. If you continue on down, you'll feel a little give there. This is the angle of the sternum, and this is the region where we can find our landmark of rib number 2. Continuing on down, we have the body of the sternum, where we're going to have some of the other costal cartilages attaching here. And lastly, we have our xiphoid process, which would be the tip of our sword, and we have some cartilage in this area as well. Okay, so now we have our full set of 12 ribs on each side of the body. Anytime you see that word costa, costal, it means rib in Latin. So I just want you to be aware of that. First, I want to take a look at a rib individually. I took this from a Netter book, but I didn't have the clear version of it, so work with me here. We have the head, and notice that this is going to be on the posterior side here. So this is the head of the rib, and this is going to articulate with the body of our thoracic vertebrae. That constricted portion will be the neck. And then we have the tubercle, and this tubercle is what's going to articulate with our transverse processes on the thoracic vertebrae, specifically at those transverse costal facets that we're going to talk about later in this screencast. We have the deepest bend of the rib that will serve as the angle. And lastly, we have the costal groove. And this costal groove is a site where we're going to be able to find our intercostal vein, intercostal artery, and intercostal nerve. So I always like to think the van drives down the hill. So V-A-N, vein, artery, and nerve. So let's classify each of these ribs. We have our true ribs, which will be ribs 1 through 7. And the definition of a true rib is that it attaches to the sternum via its own costal cartilage. So you can see these costal cartilages in gray here. And remember, that's made up of hyaline cartilage. Our false ribs are going to be ribs 8 through 12. So you can see these down here are actually latching up onto other costal cartilages in order to attach to the sternum. So it's attaching to the sternum via not its own costal cartilage. And lastly, we have our floating ribs, which would be ribs 11 and 12 here. They're not going to attach to the sternum at all. They might have a little bit of costal cartilage or hyaline cartilage at the end of the rib, but they're not going to attach. Now let's get into our vertebrae, and the first thing we'll discuss is what a typical vertebrae has. So first we have the main mass. This is facing anteriorly. This would be the body of the vertebrae. By the way, I forgot to mention at the beginning of the screencast that the numbers here are correlating to the Netter atlas that I use these images from. Okay, moving past the vertebral body, we have our vertebral arch, which is created by our pedicles. Remember, those are the little feet that come out of the body, and then also our lamina, which means thin plate. So these all together creates the vertebral arch. The hole in the middle is going to be, oh, I forgot, we put another view here of the pedicles and the lamina creating the vertebral arch, and then in the middle we would create our vertebral foramen. Another view of the vertebral foramen. Okay, You could see here, as our vertebrae stack on top of one another, that vertebral foramen is creating space for our spinal cord. And then we'll discuss this a little bit later with the intervertebral foramen, but that creates a space between two vertebrae in order for our spinal nerve to exit on out. Okay, back to our list here. We have our spinous process. This is facing most posteriorly, so you can feel the spinous processes as you would take your hand and slide it down the median plane of your back. We have your transverse processes. Of course, this moves within the transverse plane and extends out laterally. A process that we find on the superior surface will be your superior articular processes, and then facing inferiorly, before I go into that, would be your inferior articular processes. If I had an inferior articular process of L3, that is going to articulate with a superior articular process of L4. Okay, let's continue on. We have our intervertebral foramen, again inter meaning between, vertebral referring to the vertebrae, and foramen meaning hole. So when these two vertebrae come together, we are going to create a hole here, and this is where your spinal nerve will exit. Now let's move into your thoracic vertebrae, transverse costal facets. So you look on these transverse processes coming off of your vertebrae, and you'll see a slight indentation at the very end, and that makes room for the tubercle of our ribs to articulate there. The body of your thoracic vertebrae also have a superior costal facet, and this is where the head of the rib is going to articulate. So this is kind of a cross-section view of how these articulations occur. Here's my intervertebral disc sitting on my body of my thoracic vertebrae, and here is the transverse process, one here, one there. And you could see a little bit better on this side that there is my transverse costal facet. It's articulating with the tubercle of my rib. And over here we see the head of the rib articulating with that superior costal facet.